Hi, so today I wanted to just do a video about what I always allude to in all of my videos. You can't see it right now. Well, actually, yes, you can, but I've covered it up. And I can even show you how I cover it up because that's taken like a year to figure out. But the red spot on my face. So this is challenging for me because this video is also going to challenge me to put in little clips and pictures and that kind of thing of this spot. And as you know, I'm kind of challenged with that with the editing. But so to start off, I had an actinic keratosis on my cheek, and it was a little spot, so tiny, but you can notice it. Like, I don't have a picture of it, but it was a red dot that just would not go away. And I went to my dermatologist. She tried doing the cryotherapy where they freeze it off. It went away for a little bit and then it came right back, which was totally concerning to me. So what she did was she had me do 5-fluorouracil or Efudex cream. And so this is a chemotherapy cream that is used specifically to treat actinic keratoses. If you Google it, a lot of times you'll see that people use it like all over their face, all over their chest. If it's a man and they're bald, they'll use it all over their head in order to treat actinic keratoses. So what it does is if you can't see them, if you can't see the actinic keratoses or the AKs, then it will actually like treat the ones underneath the surface. So it's called like a field effect. And so what it does is it treats them. You get a response only if you have an actinic keratosis. So if you put it on normal skin that's completely healthy, you won't get any response from the cream. And if you do have an AK, then what will happen is just a series of I was told to use it for 2 weeks, but you can use it anywhere between 2 and 6 weeks, depending on what you're treating. And so what will happen is the skin will get red, it will get crusty, it will start to ooze a little bit. And then you stop the cream and then it goes back to normal and the actinic keratosis is treated. So if you don't see anything, that means that you didn't need to treat anything. So it's almost diagnostic as well. You could use it diagnostically if you're not sure. And so that's why a lot of people, if they have a history of a lot of AKs, they will just use it all over their face and treat whatever is coming up. So in a normal case, most people would do that. Then, they're done with the treatment. And then like within a month, their skin looks great. Everything looks perfect. So being that I have a collagen disorder, which I have lots of videos on called Ehlers Danlos, my skin is totally unpredictable. And what I've learned is that I respond well to like procedures. So things like BBL, IPL, those are both intense pulse light, V-beam, which I'm going to talk about in this video, which is a vascular laser that treats redness. I respond well to those kind of things, but I do not respond well to medications. So medications, I have a fast drug metabolism, which is common in people with Ehlers Danlos. So things like lidocaine, like if you go to the dentist or just any kind of medication just goes through me very quickly and I metabolize it quicker. So I actually need larger doses than you would suspect for my height, my age, my body weight. So I think the same kind of thing happened with this topical chemotherapy. And so I had the redness and it was going on for like 6 months. And went back to my dermatologist. Actually, no, I didn't go to my dermatologist. I was seeing someone for BBL, for just my general rosacea. And she was like, wow, that's really unusual to have all this redness. So then, let's see. Then she had sent me to, I think, someone that was covering or something. I just happened to see another dermatologist in the practice, and he was like, just do like a steroid cream for 3 days. That should take care of it. We see this sometimes. Nothing to worry about. Do a steroid cream for 3 days. It should get better. Tried the steroid cream. It actually made it worse. Then there was a thought that maybe it was like a fungal infection because the steroid cream made it worse. So then we tried like ketoconazole, and that didn't have any effect on it. Then there was a thought that maybe it was eczema. So what did I do? I did Eucrisa. for a good amount of weeks, and Opzelura, obviously both separately, no effect on the redness. And then they tried Rofade, which is, just a medication used for rosacea that actually just treats redness. It just causes the blood vessels to constrict, and no effect. So all these things, nothing was getting better. So then I kind of thought to myself, wow, maybe I should go see my dermatologist that did a skin cancer that I had on my neck. He's a Mohs surgeon. I'm like, maybe I should just go see him because, this is a chemotherapy cream. Maybe he has seen this, maybe he's seen it. Like, I'm going to all, these other dermatologists that don't like specialize in skin cancer. I mean, obviously they all deal with skin cancer, but they don't actually specialize in skin cancer like he does. So I saw him and he's like, well, yeah, this is extremely unusual, but he knew a lot about Ehlers Danlos. And at this point, the redness had been there for a year. And he's like, I just want to do a skin biopsy because there's a few things that I'm worried that it might be. It might be another kind of skin cancer, like a melanoma. And I want to make sure, because Efudex doesn't really treat melanoma, I want to make sure that we weren't missing anything with that. He also thought because it was circular in nature, which I'll show pictures, circular in nature, he's like, maybe it is lupus, because lupus has, like discoid lupus, has those skin-like circular lesions. And he's like, or, it just may be abnormal healing due to your Ehlers-Danlos. So I have videos on the biopsy. I was pleasantly surprised because the original dermatologist was like, maybe we should do a biopsy on it. Not the original one, the second opinion one that told me to do the steroid cream. He's like, maybe we should do a biopsy. And I was like, oh my goodness, now you're going to like, put a hole in my face and do stitches and everything like that. Like, this is crazy. But my Mohs surgeon, he convinced me, he's like, it's just a little thing. And I was really surprised, happily surprised. And I have videos on this, that it was nothing. I mean, it was one stitch, which still scared me again because of my abnormal healing. But I mean, it looked great within a week. You can't see it at all. So we got the final diagnosis back, and I was kind of hoping, honestly, it's sad when you have Ehlers Danlos because you think like, again, I did a video on this where like everything unusual, it always comes back to the Ehlers Danlos. I was almost hoping that I had like a skin disease that could be treated, but it turns out it was Ehlers Danlos. It was the abnormal scarring, abnormal collagen, all that kind of stuff. So that's what the diagnosis was. So let's see, what was that? Probably 6 months ago. Then I started going every 3 weeks for V-beam. And V-beam is vascular beam. I've used it before for my rosacea with very, very good results. What it does is it just targets redness and it targets the blood vessels. So the point is to basically destroy the blood vessel. So because they were so nervous about my skin, my Ehlers Danlos, because we would have to treat this so aggressively, for 3 weeks, I went to 10 visits. We did lots of like little test areas to make sure everything was going to be tolerated okay. And then after 10 visits, I finally got up to the starting dose. So the starting dose where most people would have started 10 visits ago. So now I'm at visit number 6. I filmed a few videos, recently of like what happens after each time. I get less of a response each time, which I guess is normal. Like I get much less swelling and bruising each time. And the overall vascularity of the lesion has gotten better, but the redness is still there in this circular way. So, I'm hoping that, again, I'm at visit number 6. I mean, usually it will take 10 visits of the normal dosing. And each time I go now, she does increase the dosing. So I am at like normal treatment dosing. I do get extreme bruising every time I go, whereas before I didn't. I get bruising, I get swelling. So I have a really good response, nothing intolerable at all, but I do get a good response each time. So my hope is that, at visit number 10, I'm doing better and I can have a happy update for you all. But, I think that this video is just to show that like, you can never, trust a cream just because a cream seems to be a better treatment. If I looked back on this, I would have just had it removed. She's like, well, you don't want the original treating dermatologist was like, you don't want a scar. So why don't we do the cream? Well, this is way worse than me having a little scar on my face. So, again, everybody's different. But that is a lesson that was learned. And, just to share this, because I think this would be a helpful video if anyone else is going through this. I am on Efudex, like Facebook help groups and stuff. And really, I have not found many people that have gone through this. So hopefully this video touches somebody. And, a secondary thing that I do want is I've always wanted to do, I have really, really nice skin other than this. And I've always wanted to do like, skincare videos that I show you like my fresh face and do the video just like most people want to see. They want to see you putting on makeup, putting on all these sunscreens and the things that I do because of my pale skin. Like that's what my channel is about. And so I needed to do this video before I start, showing the fresh face. And then hopefully, eventually I'll be able to do a true fresh face without this red mark on my face. But again, I hope that this video will help someone, and ask me questions, share your stories, share this video, comment, like, subscribe, and thank you so much for watching. And hopefully, fingers crossed, I did good with uploading videos and pictures. So see you next week in my next video. Thanks so much.